So in today's video, we're going to go over hypo and hyperthyroidism. This will be a two-part video. In the first one, we will go over hypothyroidism and some of the drugs that are involved in this system. So we're going to start off with the normal function of the thyroid and how the hormones normally work. We'll define what the hormones are and some of the autoantibodies, and then we'll go into the specifics of hypothyroidism, and then we'll go into the medication replacement therapy for hypothyroidism. So we're going to start off with basic functioning of the thyroid. Alright, I got my little drawing of the thyroid up here. Kind of looks like a bow tie, so might use that later. So for the thyroid, this is a gland located just about here in your neck that's main job is to produce the thyroid hormones. So I'm going to write gland for thyroid hormones. Now the main hormones that we're going to talk about are, right, hormones here. We have TSH, which stands for thyroid stimulating hormone. So this one binds to the receptors on the thyroid and stimulates it. So TSH, thyroid stimulating hormone. All right. Now the normal levels for TSH in your body is 0.5 to 4.5. That's the normal range of this hormone within your body. The next one we're going to talk about is T3. This is not the one we're going to dive the most into. It's a free, unbound thyroid hormone. It's one of the two that the thyroid stimulating hormone tells to be released. So T3 is free, unbound. Don't worry about that one too much. Next up we have T4. T4 is the second part of the thyroid hormone. The thyroid hormone has two parts of it. 90% of the thyroid hormone is T4, and that 10% is T3. But what your body actually uses is T3. Doesn't make any sense why we would use something that's made in a smaller quantity, but that's what we do. So T4 is free, unbound, once again. But this time, it is immediately available to the body. Okay? So it's immediately available for use. Its normal levels is 0.7 to 2. That's where you want this one. So these are the hormones that we really like. We have TSH, that thyroid stimulating hormone, T3, and T4. So these boys are good. We like them, they carry out their purposes, good hormones. The next ones we are going to talk about are not hormones, they're autoantibodies. These are things we don't want to see. So if you do a blood test and you see one of these three that we will go over, it indicates that this individual has an autoimmune disorder of either Graves' disease or Hashimoto's that we will be going over. So these are autoantibodies. Now I want you to think of autoantibodies as antibodies that attack you. So these are ones that your body made, but they didn't understand the programming step, and now they're attacking you because they have an error in them. So the first one, and our main one of importance for this video, is TPO. Pretty sure it's thyroid peroxidase antibody. The next one is TGAB. And then lastly, we have TSI. All right, so I'm going to get you the exact definitions of what those are. All right, TPO is the thyroid peroxidase antibody. Thyroid peroxidase antibody. TGAB is the thyroglobulin antibody. Really annoying name. Thyroglobulin antibody. TGAB. And our last one, TSI, is a thyroid-stimulating immunoglobulin. Once again, long words. Just remember TPO, TGAB, and TSI. All right. So TPO, thyroid peroxidase, TGAB, thyroglobulin antibody, TSI, thyroid stimulating immunoglobulin. Now these, like I said earlier, we're just testing for the presence of. We don't want to see these, and specific ones correlate with specific autoimmune diseases that we will be going over to help you understand everything else. So that's our quick little hormone introduction. The next part we're going to move on to is the normal function of the thyroid. So how your body normally gets the signals to produce thyroid hormone. Let me get a new color. Okay, so for this one, we're going to go through the negative feedback loop. So a negative feedback loop is when our end result turns off the loop. So something stimulates it to start. Once it achieves its goal, it shuts off. That's a negative feedback loop. I will add some little arrows and everything. So the first thing that happens to start this normal loop is a low T4 and T3. So those are our thyroid, wow, you can't even see that. Those are thyroid hormones, and when they're low, that's what starts this whole negative feedback loop. I'm going to get a better pen so you can see. All right, so the next thing that happens, we have the low T4 and the low T3. Your body does not want that. It wants them to be in the normal range. So the low T4 and the low T3 go and talk to the regulating part of your brain. That's the hypothalamus. So they go and they tell the hypothalamus, hey, we're low. We need you to do something about this. So the hypothalamus then goes and releases TRH. This stands for, always got to look at my notes, the thyrotropin releasing hormone. Long words, I don't even remember, I just know TRH. So hypothalamus releases the TRH. That TRH is like, okay, I understand what I need to do. Things are low, let me go get this problem solved for you. So the TRH goes and it talks to the anterior pituitary, that I'm just going to write AP for, and it tells the anterior pituitary, hey, you know that thyroid stimulating hormone? Well, we're kind of low, so could you release some of that so we can get these levels back up? Anterior pituitary is like, yeah, no problem, I got you. So the anterior pituitary releases TSH. That's the thyroid stimulating hormone that we talked about over here. So this starts to be released, and it goes and it binds to the receptors on the thyroid, and this leads to the thyroid itself releasing T3 and T4. That's our goal here. So if those are being released now and the level's going back up, that goes and it tells everything that started this, okay, we can shut off the loop now because I have enough. So that's why it's called a negative feedback loop, is because this end end product of the hormones increasing shuts off the loop because it's not low anymore. So that's our negative feedback loop. So the next thing I'm going to go into now is what is our first autoimmune disorder that causes hypothyroidism. So hypothyroidism is that low thyroid. So what causes that is normally the autoimmune disorder Hashimoto's. So I like to connect all of the O's to help me remember this is low. So our first autoimmune disorder that we will be going over the other one in the next video, and this one is Hashimoto's. Technically, it's Hashimoto's thyroiditis. I just call it Hashimoto's. Makes it a little easier for us all. I'm going to underline these O's here. That's going to come in importance later. So in Hashimoto's thyroiditis, or Hashimoto's, this is when those two autoantibodies, so that means they're attacking us, TPO and TGAB, come out and start shooting up the thyroid. Eating the thyroid, whatever you prefer. So this is when the autoantibodies TPO and TGAB attack thyroid. So when they do that and they come out and they attack the thyroid, I like to think of them like Pac-Man. Pac-Man have those little mouths, they come out, they start eating your thyroid, and eventually it starts to give you either a small or a non-existent thyroid because it's been eaten up. That's how simple we're going to get with this. Don't want you to stress, that's all you need to know. So the thyroid autoantibodies, TPO and TGAB, come out and eat our thyroid. This creates hypothyroidism because the thyroid is not producing enough thyroid hormone. So we are low. So our hormone levels would be low T4. That's the one we mainly focus on is T4. So Hashimoto's, everything is low, so we have low T4. Now, since it is a negative feedback loop, TSH, the thyroid stimulating hormone, is going to be high because it's trying to fix the problem of having low T4. So TSH will be elevated in hypothyroidism, but T4, the thyroid hormone, will be low. So match up those O's. We got Hashimoto's for hypothyroidism with low T4. So this individual has not enough of that thyroid hormone and they're not getting the stimulation they need. So these people are going to have a low metabolism. Think low and slow for hypo. Everything, just focus on them O's. That's how I remember it. It's very helpful. So low that, low metabolism, constipation, we got weight gain, we got cold intolerance, low, slow, all those things. Match them up. That's mainly a chronic concept, is the signs and the symptoms. Just think low and slow, it'll get good. So that's what's going on. So for this individual with Hashimoto's, the hypo, we want to give them something that will help increase that thyroid hormone. We want to get them back up to a euthyroid, meaning normal state. So in that case, we're going to give them levothyroxine. So you know me, I'm going to get my drug card so there aren't any mistakes here. Okay, so the drug we give an individual with Hashimoto's is levothyroxine. Make sure we do this right. All right, ready? Here we go. So for this drug card, we're going to start with the class, and the class is synthetic T4. Synthetic T4. Now I hope that makes sense to you because their T4 is low and we want to get it back up. So we're giving them a fake version. So that's the class of our drug. It's a synthetic T4. And the medication name is levothyroxine. That's the generic name. The brand name is Thyroid. It's just something to memorize, put in your back pocket. Levothyroxine makes sense. Thyroid, sometimes I don't remember. That's okay. So for this drug, its mechanism of action is a synthetic T4 replacement. So nice basic MOA, we love when that happens. The MOA, I just said, is a synthetic T4 replacement. So this is because we're trying to replace that low thyroid hormone. We're trying to get it back up so that we're not low anymore. So synthetic T4 replacement. This drug, I forgot to mention, is just indicated with hypothyroidism. So I'm going to put a little I right here. Looks like I forgot how to write. Hypothyroid. So synthetic T4 replacement, okay? The next thing we're going to focus on is the ADRs, and they make sense for this drug, which we love. Now the ADRs for giving somebody a synthetic T4 replacement is that they could become hyperthyroid, because we could have the dose wrong and we could give them so much that they get up past the euthyroid state all the way to the hyperthyroid state. So they're going to have signs and symptoms of hyperthyroid if they're having an ADR. So, signs and symptoms of hyperthyroid. Everything becomes hyperactive. We get that high metabolism, high heart rate, the diarrhea. Everything is going fast. It is running, it's going fast. That's what can happen to this person. So signs and symptoms of hyperthyroidism because they are hyper. So now we're going to go over some interactions. So synthetic T4, levothyroxine, should not be given with other drugs that affect absorption. So any drug that affects the absorption of your body, the way drugs are absorbed, should not really be taken with this one because we're playing around with the metabolism. So drugs that affect absorption. Yes. All right. So that's that one. Okay. Our nurse management for this one is to take on an empty stomach. So this one, it's going to play with your metabolism. It has a lot of side effects, especially if you take it with vitamins. So you need to take it before you eat or 2 to 3 hours after. Take on an empty stomach. That's our main nurse management here. Now for precautions, we don't want to give this to people who have heart issues. That's one of our main things. If we simplify the precautions, because we're playing with the metabolism, we could get into that hyperthyroid state. So if we enter the hyperthyroid state and give them a fast heart rate, but they have something wrong with their heart, we could cause a lot of long-term problems like MIs, cardiovascular disease. You don't want to give these. So our precautions are all heart related. Except maybe one. So that one outlier is elderly patients. That's our main outlier. Now the rest of them are heart related. We have the underlying cardiovascular disease. We have the arrhythmias, and we have coronary artery disease. Now remember, we don't want to be speeding up that heart rate if they have an problem because the synthetic T4 will take them from that low and slow state to a normal state, and that could be hard on their hearts. So our contraindication then is if they've had an acute myocardial infarction or an acute heart attack. So that is our contraindication. We absolutely do not give it to people who have had acute myocardial infarctions. So to recap, we went over what the thyroid is, its normal hormones, the guys we don't want to see. Then we went over the normal negative feedback loop, Hashimoto's, which causes hypothyroidism, which has a low T4 but a high TSH. And then we went over the medication that you're going to give someone with hypothyroidism. And that's because we want to get them back up. So in the next video, we're going to go over if they had hyperthyroidism, aka Graves' disease, and the medications that you would give them for that.